What we know is that any virus, including the SARS-CoV-2 virus, mutates over time. As the virus mutates, that can impact the ability of the virus to bind to a cell, enter a cell, replicate in a cell, and make new progeny or daughter viruses. This new strain in the United Kingdom has multiple mutations in it, and that is a normal phenomenon, and we expected it. What appears to be the case is that this virus can spread more rapidly between people. And we know that because over time, more and more of this virus is being isolated. We don't know how far this virus has spread throughout the world. I personally think it is probable that there are strains of this virus already in the United States. We don't know if there are reasons to think it causes worse disease. So far, the indications are not. So I think the take-home message is today, a lot of unknowns. Our treatment should still work against it. Our vaccine should still work against it, but it appears to spread more rapidly.
More than 10 million people in London and surrounding areas will move back up into Tier 3, the UK's highest restriction level. Health officials have identified a new variant for the coronavirus in southeast England, and that's causing considerable consternation. Scientists are investigating further, as we're going to hear from Cindy Palm, who is in London. Cindy.
Good morning, Heather. So scientists believe that this new strain that we're seeing is the reason behind the infection rates, the growing infection rate that we're seeing here in London, as well as other parts of southeastern England. It's not 100%, but they believe the data shows that it is leaning in that direction. They do admit that more laboratory tests do need to be done. However, England's chief medical officer, Chris Whitty, is also trying to calm fears over this new strain. Here's what he said. Take a listen.
So far, there is no evidence that the symptoms are any worse or different from other variants of this coronavirus. And there are many variants. And I think it's not just there's one coronavirus and this is the variant. There are many variants. It just happens that this one has quite a few more mutations than some of the other variants. So that's the reason why we've taken it more, particularly seriously.
And Health Secretary Matt Hancock stresses there is nothing to suggest that this strain would not respond to a vaccine. The UK became the first country around the world to start administering the Pfizer-BioNTech vaccine. It began in hospitals last week, and this week, family doctors' offices are getting deliveries. This is the first vaccine that has been approved in the Western world, and many more are still awaiting regulatory approval. Heather?
We're going to talk more about this variant in just a few minutes with one of our doctors, Cindy. Yes, interested in some of the perspective on this and how concerning it is. I'm also interested, though, in these new restrictions about to arrive in London and the southeast part of England. What does that mean for people who are living in those regions, and what does it mean for their holiday season?
And that's the big question that everyone is wondering. Originally, the plan was to relax restrictions around Christmas so that family members can gather. What we do know right now is that London and much of southeastern England, much of the country is under Tier 3 restrictions, which means that restaurants and bars have to close other than for takeout and delivery. Shops, however, do remain open. And there is, of course, the limit to the number of people you can gather with outdoors. You can't meet with anyone indoors with whom you do not live.
ABC News contributor Dr. John Brownstein joins us now. Thank you so much for your time, Dr. Brownstein.
Thanks, Ariel.
This variant of the virus is stoking some alarm, with some countries temporarily blocking travel from the UK. But so far, experts are saying it's no more lethal or transmissible than the current strain. So what do we need to know?
Yeah, I mean, on such a day of such optimism with the vaccine, now we're dealing with this new variant. And there is some cause for concern. And I'll give some reasons why scientists are sort of concerned about this particular variant. One, this version is replacing rapidly other versions of the virus, and we've seen this rapid increase in cases in some regions of England. This variant has mutations, actually 17 mutations, which is a lot for variants that we've seen historically. And they're on the part of the virus, the spike protein that is used for entry into the cells. So these mutations potentially are creating increased transmissibility of the virus. But there's some important caveats. One, we see variants like this emerge all the time, and the data is very early, and so it could be biased with the fact that we saw increased mobility and travel, and so maybe we're just seeing artifacts of data. And there's really no evidence that this virus is more lethal. So that really should quell some concerns that this virus is going to cause a real problem. It still adds to the growing body of knowledge that we have of these viruses and the importance of basic public health measures like social distancing and mask wearing.
I think the question on everyone's mind, you mentioned the good news about the vaccine. So could this impact the efficacy of the vaccines that have now been deployed in any way?
So far, scientists don't believe so. We think that it takes years for these mutations to build up in a way that they would have an impact on the vaccine. Unlike monoclonal antibodies, vaccines make actually what we call polyclonal antibody response. And that means that there are multiple ways that the vaccine can protect you. So a few mutations of the virus will not impact the ability for the vaccine to prevent you from getting severe COVID disease. The bigger concern is around what we call antigenic drift. And this is the change in the virus over time. This is what the flu viruses undergo, which means that we need a new flu virus vaccine every year. And so what we're thinking more is the long-term needs of vaccines and how we may need to change this vaccine over time. But the concern immediately over the existing vaccines are just not there. And we should be proceeding as we have been, thinking that we're going to really have an impact on this virus with mass vaccinations over the coming months.
Should we be concerned at all that there are still flights coming in from the UK, or is the risk no greater than it was before?
Well, this is a tough one because, of course, the more people that are coming in that are potentially affected are adding to the sort of the numbers of cases growing here in this country. Now, this variant has been actually circulating for months, so likely it's already here in the US. So a travel ban probably wouldn't do very much at this point. What we should be doing really is testing, right? Testing before people get on planes, testing when people arrive, quarantining. Those are widespread policies that could be incredibly helpful right now, and we just haven't implemented them as a country. Those are things we could do immediately. New York is starting to do this. I think it's something as a country we need to be doing right now.
And of course, the busy holiday season is now upon us. So many Americans are making this difficult decision about when, how, if to see their families these holidays. What is your message to anyone thinking about traveling?
Right. So we're seeing this surge that happened post-Thanksgiving, and we're seeing the data, which is really tough to see, right? The numbers of deaths and hospitalizations at record highs. That was a surge on top of a surge. Now we add Christmas travel, which is more people traveling over a longer period of time. Are we going to see a surge on a surge on a surge? And our hospital systems just can't handle that capacity. We're already near overwhelmed in many parts of this country. So what can we do? Of course, if we can, stay within your household, don't travel, really try to limit your mobility and your interactions with others. There is that light at the end of the tunnel. So whatever we can do now will be so helpful to get through this pandemic.
Back now to the vaccine. So many are talking about this. President-elect Joe Biden received Pfizer's vaccine today, and tomorrow Dr. Fauci is slated to receive Moderna's vaccine. How important is it, in your opinion, for boosting public trust to see these officials getting their vaccines?
Yeah, I think it's so important. First of all, having a safe and healthy federal leadership is absolutely critical. So I think it's great that they're getting the vaccine. But on top of that, it's all about instilling public confidence. Our research has shown that hesitancy is widespread. We have large parts of this population. They're just unwilling to get this vaccine, no matter how much good research has been done. So seeing these important public figures getting the vaccine really is all about boosting trust in science that we need now, because we need that herd immunity, 78% of the population getting immunized if we're going to have a real material impact on the course of the pandemic.